Hello, this is Sherry from the CGH Health Foundation, and welcome to our program today. Today's one of our Growing Healthier educational series. These are programs about important health topics, and they're sponsored by the CGH Health Foundation. October is Breast Health Awareness Month, and today we've invited Erica Adams, who is our nurse navigator in the CGH Diagnostic Imaging Department, and also Summer Roots, who's our oncology case manager, to come and speak to Dr. Bird about the important work that they do in helping women who get a breast cancer diagnosis to deal with all of the details and decisions that have to be made about their treatment. Before they get started, I want to tell you about our upcoming programs as well. On November 17th, we'll have Dr. Preeti Joseph here to talk about various types of dementia and testing and treatments that are available for them. And then on Thursday, December 1st, Dr. Song will be back again to continue the discussion she started in June about men's and women's sexual health. All of our Growing Healthier programs are available here on Facebook Live, but don't worry if you miss one. They're recorded, and you can find the past programs on our YouTube channel. Just go to the CGH website, click on menu, and look for YouTube and radio interviews under the Health Resources column. And one last thing, the Health Foundation Delicious Designs virtual auction kicked off this morning. It is live. The proceeds from our fall auction usually goes to benefit our women's health program, and they do this year. And that is the program that provides screening and diagnostic mammograms and ultrasounds, and also gynecological screenings to women at no out-of-pocket. And so it's a great project. A portion of this year's proceeds will also fund our Dementia Awareness Project. The Health Foundation is devoting a lot of time this year to educating our community about the various forms of dementia, Alzheimer's included, and developing resources to help assist patients and caregivers. We're holding a series of workshops for caregivers and establishing support groups and several area communities. So that's also a very good program. So check out the auction site. The easiest way to find it is by going to the foundation page on the CGH website, and you'll see the link right there at the top of the page. All of the proceeds from our auction, and in fact, all of your donations to the Health Foundation campaign, stay right here in the Sauk Valley area to help you and your family and your friends and neighbors to live healthier lives. So I will thank you for listening and turn it back over to Dr. Bird now.
Thanks, Sherry. Appreciate it. I think you said the Delicious Designs is alive. Where's Sherry at?
Oh, yeah, the link is live. Yeah.
Okay. No, I was just kidding because it sounded like you said alive. And I'm like, oh, it's alive. It's alive. It's alive. All right. Good enough. Thanks, Sherry. Appreciate it. All right. So I want to bring up us. I'm going to bring Summer and Erica in just so you can see their faces. There they are. Hi, Summer. Hi, Erica.
Hello.
I know they are both fired up to get a chance to talk about what they do. And really they are. Just they're a little nervous about the whole situation. But it's going to be good, isn't it? I mean, good information, a lot of fun. I am going to start with interviewing Summer. So bye, Erica. See you soon. Okay, so Summer, I wanted to ask you a few questions. You ready to rumble here?
I'm ready.
All right. Okay. So if you would just explain your role as the cancer case coordinator and how that fits in with all the other work being done here at our CGH oncology department.
Okay. I serve as the supportive services piece. I'm often the patient's or the family member's connection to other parts of the cancer care team. I can initiate advocacy, linkage, referrals, psychosocial assessments, help with palliative or survivorship care planning. So basically, I work to identify the needs of the patients and then attempt to meet those needs.
Yeah, and I think you've been at this for how long now? Not like a real long time.
So in this specific role, I started on Valentine's Day, so just since February this year.
Okay, all right. So yeah, I mean, I would consider that still relatively. You're kind of getting your feet about you and everything. How has your experience been in this role so far, Summer?
It's been amazing. As someone who's worked in social services for 25 plus years, it's very rewarding. And it's a continually rewarding feeling to know that you're helping others and making a difference in their lives. This job presents many opportunities to be in a supportive role for cancer patients and their caregivers, and I love doing it.
Mm. Any common themes or situations that you're able to help patients out with as they kind of navigate the the cancer diagnoses that they have?
So while each patient is unique, there are some common situations that do tend to present themselves. Through observations and interactions with the patients, needs are identified and appropriate referrals are made. Some common referrals that I am involved with are assistance for transportation, physical therapy for possible weakness, decreased range of motion, or deconditioning, occupational therapy for monitoring and or treatment of lymphedema, nutrition education for weight loss or loss of appetite associated with their treatment, ways to wellness counseling services for management of anxiety, depression, other mental health concerns, and palliative care for in-home nursing services, and that can include hydration, blood draws, med management, things like that.
Yeah, good. Any from your experience, any tips for patients and their families going through a cancer diagnosis and treatment?
So it's going to be pretty basic. We really want to encourage you to talk to your cancer care team. Let us know your concerns. Ask questions. We want to ensure that you're understanding everything that you're being told, all the information, that you know your options for treatment. And we want you to know that you're not alone in this process. We're here for the full ride to support you.
Good. And then I guess what's the favorite part of your job, Summer?
Okay. My favorite part is knowing that I'm a part of such an amazing and supportive team. And we get to help others in need every single day. Each of us in our department has a role to play. And I'm sure I'm biased in saying this, but I think our oncology department is the absolute best. If I could give a shout out to all our reception, MAs, nursing staff, volunteers, providers, our manager, and of course our patients, they are the best.
Mm. Yeah, I agree with you. We have an outstanding oncology department. Wish we didn't need to have one, but we do, and they do great work for sure. And the final thing I just wanted to just give you an opportunity to talk about is how your position has been funded.
So my position was funded through a very generous gift from the Penny Hammer Memorial given to the CGH Health Foundation. And then oncology made a plea for my position, and here I am. So.
Yeah, and we're glad to have you. And I wanted to ask that question because Penny was an employee here at CGH for so many years in our speech therapy department and was a wonderful woman. I just wanted to make sure we acknowledge that's part of why you're sitting here talking with me.
Yes, I'm very appreciative.
Yeah, great. Summer, I'm going to pull you back in a few minutes, but I want to get Erica on now, so thank you. Okay, Erica.
Hello.
Hey. So you ready for a few questions too?
I am.
All right. So just talk a little bit about your role as the breast navigator here at CGH, what that involves.
So like Summer, I do facilitate and help patients through their diagnosis and through their treatment. I help coordinate their care with other healthcare team members like the cancer care team. I also help try to eliminate barriers and recognize barriers such as like financial assistance and transportation. We provide psychological and emotional support. And then we also can connect women with local resources such as Home of Hope and Illinois Cancer Treatment if needed. So basically I act as their liaison during their diagnostic phase of their treatment or their care.
Okay. So I guess I want to touch on one other thing too, that's since the pandemic has kind of been something we've been talking about. How would you say women are doing about getting their screening mammograms since the pandemic started?
During the pandemic, we did see some delay in women getting their screenings, and that could be for a multitude of reasons, such as, they're taking care of loved ones, being ill themselves. A lot of it reasons women were stating that they were fear of contracting COVID. But the problem with those is that we were seeing women being diagnosed at a later stage because they did skip that year. But we're slowly getting back to normal. We're not there yet. So we are encouraging women, if they haven't had their screening mammogram because due to COVID, that now's the time to get back into the routine of having that annual screening.
Yeah, that's good. And I just saw this article a day or so ago. I was looking at this here, and it says the National Cancer Institute estimated that I think it was I'm looking at 9.4 million screening tests that normally would have taken place in 2020 did not happen because of the pandemic. Now, that's not all mammograms, but just screening tests in general. So it's definitely one of those things that I just want to make sure that our folks who are watching are aware of. Hey, if you have things that need to get done from a preventive medicine standpoint, we encourage you to do that. So let's talk about 3D mammography. That's something we've had now at the hospital for a little over a year now. Do you want to talk a little bit about how that's working out, Erica?
Yes, our patients love our new 3D mammography machine, and so do our technologists. We've gotten a lot of comments about that the machine feels more comfortable than the previous machine. And we have seen a decrease in callback rates because of the more detailed imaging, which is what the technologists love about the 3D mammogram tomo, is because of the detail versus the older 2D.
Yeah. How has that changed the breast biopsy process, Erica?
So anyone who's had a breast biopsy in the past probably remembers the horrific breast biopsy prone table, which is where you lay on your stomach and your breast goes through the hole, and it's a very, very uncomfortable table because it strains your lower back and your neck. So it's very uncomfortable. But now with our new machine, we're able to put the woman in an upright chair, and they're more comfortable, and there's no strain on their neck or their back. And we've got, again, a lot of compliments on the improvement of that whole process.
Yeah, good. Yeah, and you'd think sitting up would be a problem, but it sounds like patients tolerate that really well.
Yeah, I was kind of nervous about it as well because they would be able to see everything, but because the technologists are in the room, I'm able to focus on the patient, which is my role during the biopsy. And we just have the patient turn their head to the side so they can't see, what's going on. And we're really just kind of talking and walking them through what's happening. So they're being coached during the process, which also helps eliminate, their fear of not knowing what's going on. So it's much easier to be able to communicate with the patient and kind of help them through the whole biopsy procedure with them in the chair.
Good. By the way, Erica, Rebecca sent you a little chat on something. Just make sure you're okay. All right. That's all right. No worries. All right. How quickly can you get a woman through the process of abnormal mammogram, breast biopsy result here at CGH?
So typically when the woman comes in for a diagnostic mammogram, we show the images to the radiologist if they are available. If they're not available, they usually read that exam within one day. Depending on what day of the week that is, if it's on a Monday or Tuesday, we try to do our best to get them scheduled that same week. But if not, it's usually within the next week that they're scheduled for their biopsy. After their biopsy is complete, it takes 4 to 5 business days for the path report to come back. And then at the time of biopsy, we schedule the patient for a wound check. We have them come back where we can look at the site, make sure it's healing well, and then we go over those test results with that patient in person with a support person if they want to bring. And at that point is when we set them up with a surgeon of their choice. Okay.
So speaking of which, tell me about your role about when a woman has a diagnosis of breast cancer. What's your role in getting them to one of our breast surgeons or oncologists?
So my role is very much of a supportive role when they're first getting that diagnosis. And luckily I'm able to already have an established relationship with that patient because I initiate interaction and communication with that patient with their callback. And then I usually see them on their diagnostic day and set them up for their biopsy. So when they're here getting their test results, I provide a lot of education that initial day because there's a lot of questions. And then I set them up with their surgeon that day. They leave my office with an appointment that same day. If they're wanting something sooner, or that way we can accommodate the patient's needs, such as like time of day, what day their support person's available, we're able to get that done that day. And at that point, I then I call our nurse navigator in oncology, Sue, and I do a handoff communication with her, because eventually that patient, after they have their surgical procedure, will see an oncologist for a referral. So I do the handoff to Sue, where she can pick up to help with the oncology side of the navigator role, along with Summer.
Right. So let's talk about that. Let's get Summer back on if we could. Okay. So I want to ask the two of you, while you're together, kind of talk to us a little bit how you coordinate that whole process with breast cancer patients between the two of you. And I guess we could even throw Sue into the mix too.
So yeah, again, once they're diagnosed, we make that referral to Sue, and I do that handoff with Sue. And at any point they need anything else from me, I assist them. And then we tag in Summer as well after Sue evaluates and sees the patient. And then Summer, you want to?
Sure. So once the patient has begun care with the oncology team, is when I'm kind of brought in and introduced to the patient and their family. It's at that point that I start identifying those needs and preparing appropriate referrals, including the ones that I talked about earlier. But an additional piece that I'm brought in for is assisting the patient in obtaining a turban or a hat, and then linking them with getting a free wig as well, especially if they're going to be experiencing the hair loss. Yeah. And then again, I'm just that supportive piece. So as they go through their treatment, I identify any additional needs and make the appropriate referral at those times.
Yeah, great. Well, thank Ms. Jackie said, I agree with you, Jackie. Thank you for those kind words. Yeah, I hope folks who are watching this get a sense that I think here at CGH, we've done a really nice job of helping patients through the process and through the experience of getting a diagnosis that they don't want to get, but we have people like Erica and Summer available to help them through that process. So thank you, Erica. Thank you, Summer, for the work that you're doing to truly be there for our patients.
You're welcome. It's definitely a team effort. So I appreciate everyone's efforts. We have a great radiology team and a great oncology team. So I agree.
Yeah, our interventional radiologists do a great job too. And we've talked about Sue Hegman, and Sue does a great job as a navigator for these patients. So anyhow, I'm really proud of what we offer here at CGH, and wish we didn't have to offer it, but we do. And if you're in one of our communities that we serve, I hope you're watching this and realizing that you're in good hands here at CGH. So, thanks, Donna. Yeah, I agree. All right. So, Erica, Summer, thank you for taking the time to chat with me for a few minutes. And I am going to let you get out of here. And I have a few shout outs to give. Okay. All right. So let's do some shout outs. And also just some informational things. So Caton Parrott just recently received the Daisy Award. Caton works in our critical care unit and does a great job. So congratulations and shout out to Caton. And Pam Fugate also is an MA in orthopedics and recently received the Sunshine Award. And a shout out to Pam. So wanted to highlight those two individuals. Yes. Flu and COVID vaccine clinic continue to happen on Tuesdays and Thursdays in the main clinic atrium. Boy, it's been I was in there, I think last Tuesday, pretty busy place. So getting a lot of folks to get both of those shots. And then Saturday is our last Saturday flu clinic from 8 to noon in the main clinic atrium. Okay, and if you're thinking about trick-or-treating, we're going to have something going on in our clinic main lobby on the 24th to be aware of. And yes, it's getting to be that time where we're going to turn on the holiday lights. So I just wanted to make sure that you're aware that that is something that we rely on donations to continue to expand that and allow that to happen. So the auxiliary office is a place that can be dropped off, or you can call CGH and they'll get you that office and they'll be able to contact you and get that all worked out. So want to make sure you're aware of that as well. Oh, and then this is Healthcare Quality Week. So I want to shout out to our quality department, and Infection Prevention Week, which is kind of embedded within our quality department as well. So that's Katie Funstein for that. And who else do we have? Medical Assistance Recognition Week. So I want to shout out to all the medical assistants we have here at CGH. And this is also National Pharmacy Week. So happy Pharmacy Week to our pharmacy team. Okay, and Facilities and Engineering is Engineering Week. We have a lot of weeks going on here this month, so I'm glad we get a chance to do shout outs for all those folks. Okay, I wanted to give a brief update on COVID-related issues, and just to say that no surprise, there's a new strain that is beginning to kind of take hold more and more from the previous new strain. Not unexpected. The good news so far is this new booster vaccine seems like it appears like it's going to be helpful even for the new strain, although that's still to be determined, but it's definitely helpful for the BA5 and 4 that have been around. So, and also there's been some increased flu activity, not quite as heavy here as you see down in the southern states, but it seems like the season's maybe going to come a little earlier this year. So all I would just say, encourage you to continue to do is, if you haven't gotten your COVID booster yet, to go ahead and get the most recent booster. And while you're at it, why don't you just get a flu shot as well? You can get them both at the same time. Other than that, I think that is all we needed to say this week. Thank you so much for taking the time to watch us. We'll be back November 3rd, and we'll be doing this again. Until then, have a great couple of weeks, and have a happy fall.